Okay, so morning everybody. Welcome to this Want to Know More About session about the links between COVID-19, racism and health inequalities. So my name's Andy. I'm here to help my colleagues this morning with any technical issues. Hopefully we won't have any, but please do bear with us. As I say, all this delivering stuff online is still a little bit new to us all, as I'm sure you can appreciate. So I'm just going to run through a couple of little bits of housekeeping before we get started. So today's session is due to last until about 11 o'clock. We are recording the session so it can be put up on the Leeds City Council's Public Health training playlist, which is on YouTube. Your microphones and cameras have been turned off, but we do have a Q&A session. So if you look at the bottom of the screen, so on the left-hand side, you'll have two tabs. One says presentation, one says Q&A. If you click on the Q&A one, you can pop a question in there at any point, and one of us will be monitoring it, so we'll get back to you on that as well. Obviously, just click on the presentation to go back to the presentation. With no further ado, I'll introduce my colleagues. So from Leeds City Council Public Health, we've got Mindy Gruel and Pierre Bruin. And then we've got Shak from NHS Leeds CCG. So over to you guys.
Thank you. So hi everybody, thanks for joining us. My name's Mindy. So this is an overview of what we'll be covering in the session today. And just to note, some of the information and detail might be sensitive and emotive. So it's important that we consider this as a safe space for everybody today to be able to share their experiences and views openly. It's also important to note, I think, that as we only have an hour, we're not going to go into any depth with the topics, but just provide an overview. And it's a point in time and things are always evolving. Before I start, I just wanted to touch on the term cultural diversity because there seems to be a lot of conversation about this at the moment and what this actually means. So language is really important and the words that we use can make a really big difference to how people feel and are valued. So the term BAME is not always considered by everybody as a positive term, but I think for the purpose of this webinar, we're going to use it to represent solidarity and strength for Black, South and East Asian minority ethnic people. And we know that BAME communities are not a homogenous group, so they will also include people from many different backgrounds. So when we use the term BAME today, we're referring to communities who experience discrimination as a result of their ethnicity, their nationality, their religion or their faith beliefs. So COVID and the disparities in risks and outcomes for BAME communities has shone a light on existing health inequalities. And I think it's important to understand the wider and historical context to demonstrate how BAME communities are experiencing the pandemic. So the historical concepts of slavery and colonialism sometimes reinforce stereotypes and bias, where perceptions of a lack of intelligence, perhaps low performance and cultural stereotypes still persist. And this bias and stereotyping is reflected often within the education system. And we're also seeing it being played out in how the pandemic is being reported and responded to over the past months in the media. Certainly the killing of George Floyd and the global demonstrations in support of Black Lives Matter also challenges this long-standing inequality and discrimination. Interestingly, during the pandemic, we've commonly heard the phrase, we are all in this together, we will come through this together. But there is a certain echo of who is we. Yes, we can appreciate that it's a global pandemic and society as a whole has been affected, but we also know that the risks, experiences and outcomes of COVID have not been the same for everyone. So for some communities, it probably doesn't always feel like we. And then just moving to this kind of diagram, when we look at the different forms of racism that exist, at an interpersonal level, we still see people subjected to physical and verbal abuse. But when we consider wider experiences, I think it's important to note that it's not always about seeing racism as conscious hate. So when we move to structural and systemic racism, this level of racism can persist over time, and it's about how things are embedded and operate at a societal level. I think a really good example of this is the Windrush generation, where we saw workers from Jamaica brought over to help fill post-war UK labour shortages. But centuries on, these very same people are now being threatened with deportation from the UK, and some even losing their homes and jobs because their sport is no longer required by the system. And I think this example shows us that when white middle class people have the decision-making power, then ethnic minorities will always have greater challenges to participate in society and the economy. And it also shows us that inequalities are perpetuated within a larger system of oppression, and that's what really needs dismantling. When you move to institutional racism, and we look at that, it presents itself in society, I think, in the form of attitudes, behaviours and processes. So that's more overt forms of racism at work that we could easily recognise as bullying or verbal abuse. But there's also things like not being allowed to access training and development opportunities as easily as your white colleagues, or being singled out for unfair treatment, and these things could often be a bit more hidden. And I think often BAME workers may not report these incidents because of a fear that there will be repercussions at work. And even when they do speak up, some people may be considered aggressive. I think the killing of Stephen Lawrence and the subsequent Macpherson report is a really good example of institutional racism that we've seen within the police force as well. When we look at the education system at schools, the data strongly suggests that Black Caribbean students are, 3 times more likely to receive harsher penalties, along with other groups such as Gypsy and Roma pupils, than white students. And then we look at the media and how events are being covered, that can often perpetuate racism and fuel racist ideologies. So language like they're taking our jobs becomes quite toxic. And I think it's this level of unconscious bias that is playing a more critical role in how people are experiencing racism today. In the introduction, I touched on language, and I just wanted to consider this a bit further. So very often employers use phrases like diversity and inclusion when we're talking about supporting BAME people in the workplace. But I guess this gives the impression that the group who's opening the door to diversify and include others still holds power and superiority. We also hear terms like tolerance. And when we look at what this translates into, it means putting up with something. So in the context of people living together in the same society, having the same rights and responsibility, it raises questions like, why should somebody accept to be tolerated because of the colour of their skin, or where they or their parents were born? Why should somebody else hold the key to include you? Dr. Nisreen Alwan has done quite a bit of work around kind of how we use language in the workplace. So if you're interested in this, please do go Google her and look at some of her work. I think there's a real need for us all to do a bit more to invest in equity, justice, and bring fairness into our actions, and language plays an important part in this. So there's overwhelming evidence that tells us that people from a BAME background are more likely to be diagnosed with mental health problems. So we know that Black women have the highest rates of common mental health disorders and are less likely to access treatment. Black men have the highest rates of psychotic disorder, and they're more likely to be admitted in crisis to mental health care settings than white people. And when we're looking at access to support services, a report in Leeds showed that students who do not come from the UK have less awareness of services and information and have lower resilience in looking after their own health. If we consider the state of mental health in other groups, we know during the pandemic there's been an increase in hate-related crimes, particularly against Chinese people, for those perceived to look Chinese, and this has led to these communities seeking greater psychotherapy support. I'm just going to touch on this briefly, but the Public Health England Disparities report released in the summer highlighted a number of inequalities, and the largest disparity found was by age. So people over the age of 80 were 60 times more likely to die from COVID than those under 40. And the risk of dying amongst those diagnosed with COVID was also higher in males, people living in areas that are more deprived, and significantly higher in BAME groups. So looking at more recent data, the Office for National Statistics report published now in November 2020, it shows us that the first wave of COVID saw higher rates in London, the North West and West Midlands. But now that we're in the second wave, we can really see a north and south divide, because Yorkshire and the Humber have recorded 4 of every 10 deaths since October. We now know that 30% of all deaths that were recorded were people in care homes. 3/4 of those who died were aged over 75, and a larger percentage of those who have died have been men, with the highest deaths in particular amongst South Asian and Black African and Caribbean communities. And when we look at the occupation groups that have been most affected, there's no surprises that it's those people who work on the front line with a large proportion from BAME backgrounds. And it's those working in food and tobacco processing environments, care staff, transport drivers and security staff. And for women, it's hairdressers who have been linked to high rates, and also care staff. So findings from a report produced by a group called Doctors of the World in May engaged a range of socially and economically vulnerable communities. And the report shows us that a lack of digital access is making it really difficult for people to understand COVID messaging and guidance. And as we know, this becomes particularly problematic when the advice is only available in English. There are low levels of literacy amongst certain groups, so they're not fully able to comprehend the messages like others in society. Services have been closed down that people would usually rely on to access support, such as community centres, health centres and libraries. And people who are experiencing changes to their immigration status, homelessness or bereavement have obviously got further challenges for their mental health, with an increase that we're seeing in fear, anxiety and depression.
Great, thanks, Mindy. We've just got a couple of quick questions. So there was a question just for you to give the name of the researcher you mentioned, Mindy.
Oh, it was Dr. Nisreen Alwan.
We also had a question around why hairdressers have had such a high rate, and I think it's a very direct contact type kind of occupation. So I think that's why we think that's happened a little bit more. And I think the guidance around some of the PPE has become more robust. I also think that for hairdressing, sometimes that's been in the salon, sometimes that's been a case of people going into homes. So it's just the ONS data was really interesting that it was so much higher in that particular occupation. Okay, so my name's Pia. I'm just going to go through a few of the next slides. So when Keir Starmer became the Labour Party, he asked Baroness Lawrence to do a review into the disproportionate impact of COVID on BAME communities. And the report that came out in October identified a few areas for key actions. Unsurprisingly, based on the things that Mindy said, there is significant barriers to accessing healthcare for many of our Black, Asian and minoritized ethnic communities. And this is perhaps particularly being felt at the moment for some of our migrant communities who don't have access to, that have no recourse to public funds. So additionally, barriers being faced there. Identified that for there is an overexposure to COVID-19 for our BAME communities, and this is partly linked to occupational risk. And Mindy's highlighted some of those occupations. So for many of our BAME communities, they are more likely or are overrepresented in some of the occupations that are more public facing and therefore creating more of a exposure risk. Similarly, there have been issues around access to PPE in some of those occupations. And increasingly, we are seeing concerns around job security, income concerns. Similarly, there is concerns around housing. So again, for many of our BAME communities, for the reasons that Mindy mentioned in those kind of three interconnecting circles, are overrepresented in our more deprived, our communities ranked as most deprived, and are more likely to live in poor, often privately rented accommodation, and more likely to live in multi-occupancy housing or overcrowded housing. And this has been linked to resulting in stereotyping and stigmatisation of many of those communities. We found as the pandemic has gone on that nationally there haven't been very many community-specific awareness raising campaigns or materials distributed. So communication and engagement at a national level is not necessarily reaching and hitting home in the right way with many of our communities. And that's certainly something that we've experienced in Leeds. There remains gaps in data. there's a lack of consistent reporting around ethnicity data, and that's not been specific to COVID. That's an issue that we've been aware of for a long time, I think. And similarly, although there has been some positive steps in terms of tackling structural racism, it still persists. And one of the examples that was given in the Lawrence Review was the Lammy Review. So David Lammy is an MP in London. He was asked to do a review into the justice system, and they found that Black, Asian and minority ethnic community young offenders in custody rose from 25% to 41% between 2006 and 2016. And this was despite the overall number of young offenders being at record lows. So it this is how that sort of structural racism that Mindy talked about translates into experience. And the Lawrence Review also looked a little bit at the response to people violating lockdown rules. And Liberty looked into this and found that police forces in England and Wales were 7 times more likely to fine people from a BAME background for violating lockdown rules. If we try and translate some of this national overview, if you like, into a local picture, around the same time as the Public Health England Disparities report, the council produced 2 or 3 similar reports based on our local data and evidence, including a health inequality report looking at COVID-19. The findings were pretty much reflected that national Public Health England data, so I won't go into that in any detail. But as Mindy said, we are in a particular moment in time, and the pandemic, I think it's worth noting that the pandemic is new and evolving. We are learning, try and understand it, and trying to learn lessons around the best way to respond and try to contain it. And when we look at the Leeds picture, Leeds, like the rest of the UK, when back in March, when we went into the first lockdown, were very much responding to high hospital admissions, cases in care homes. Most of the cases that were in hospital were older people or people with high clinical risk, long-term conditions. NHS was responding very much to this. As we've moved on and we're now sort of 9 months into the pandemic and we're in our second lockdown, we have a better understanding of community transmission. So we now have testing, widespread testing across the community, not just in hospitals and care homes. And we can see that COVID is present in all of our wards and all of our age groups. There has been some variation in some of that at some point. So in the summer, we saw a particular spike in cases among young people as we had the Eat Out to Help Out and a reduction in restrictions. In September, we saw a spike again in younger people as students returned to universities. That's now significantly dropped down, reduced those student cases. And now we are again seeing a rise in transmission in our older people and vulnerable people, and consequently a rise in hospital admissions and death rates again. And I had a quick look this morning just to sort of see what our latest figures for Leeds were. So as of yesterday, we had 368 new cases in Leeds, and our rate per 100,000 was 442.4. So out of every 100,000 people in Leeds, 442.4 people have tested positive. That is a slight reduction, so we are seeing a very slight trend downwards in our rate. When you look at Yorkshire and Humber for hospital admissions rate, that's still on a upward trend. And when you look at our positivity rate, so you may see sometimes a discussion around, well, the reason the cases are going up is because there is more testing available, and there is some truth to that. but the positivity rate is able to kind of look at the number of cases compared to the number of cases that have been tested and how many people are positive, and therefore that kind of gives you a more accurate rate around whether the numbers are going up and down. And our positivity rate in Leeds at the moment is about 16%, and the World Health Organization suggests that it needs to be 5% or lower to be in control of a virus. So we have a bit of a way to go, and hence why we're in a kind of second lockdown. One of the things that we've learned as well is that, as I said in the previous slide, one of the things that the Lawrence Review found was that national messages is not necessarily resonating with all of our communities, and in Leeds certainly we found that one size doesn't fit all. If we're trying to engage with our communities, we need to understand what their concerns are, what their barriers are, what information is getting through, and provide that in appropriate ways. Increasingly as well, as the pandemic has gone on, we are seeing that the impact on the wider kind of social and economic factors of the pandemic, there is some sort of there is some evidence to suggest that this kind of moving in and out of restrictions is really quite exhausting for people and has an impact on people's mental health and resilience, and being in lockdown also kind of has an impact on that. As the pandemic has moved on, there's been an increasing income and job insecurity. We hear of, we've heard of major national companies that have gone into liquidation. There's been significant redundancies. There's been ongoing issues around access to food. And there's a rise in an awareness around long COVID, and I'm not sure if people are familiar with that term. But again, as the pandemic has gone on, we've come to realise that for some people, not everyone, COVID has had a persistent long-term impact on people's health, particularly on fatigue. So as people all know, in the first wave, there were a number of front-facing health and care staff who also tested positive for COVID. Some of those are now still on sick leave, as they are, as that kind of longer impact of COVID is something that they're still dealing with, or not able to return to work in their full-time capacity. This is a graph that was in our local health inequalities report from Public Health. Going through this quickly, it's unhelpful. When the slide was developed, we were still in the first wave, so it's better to perhaps refer to these four elements on the slide as stages or phases rather than waves. And when we look at this, it's just helpful to understand that a pandemic kind of moves through a period of time. So if we think of the first phase here, you can see that very clearly reflected in our first lockdown and where we were at in March, where the pandemic had a massive impact on the NHS that was having to very rapidly try to respond to increasing hospital admissions of very, very poorly people, and transmission also within their staff, and a rising death rate. This then has a knock-on phase two, or stage two, if you like, where that need for the NHS to focus on that kind of very urgent element of the pandemic means it's less able to respond to non-COVID urgent care. So the ability for A&E to respond to other health conditions and emergencies. And then moving on, this starts to have an impact on more kind of support around not only hospitals, but kind of primary care's ability to respond to long-term conditions and the screening and vaccinations that are happening. And then you move into the bit that I talked a little bit about in the previous slide, that sort of impact on the longer term social and economic impact on both individual and businesses. And that's very much, I think, what we're increasingly seeing now. And in lockdown version 2, as we're here now in November, this graph probably doesn't quite reflect where those different waves are. I would say we're probably now where phase 1 and phase 4 are probably at about a similar level, and 2 and 3 are probably a little bit in the middle. The NHS this time round, I would say, has learnt a lot from the first wave in March, that started in March, and have tried really hard to retain as much of its critical non-COVID as possible, whilst also responding to the increase in hospital admissions. And I'm sure our colleague Shak from NHS Leeds CCG would be able to support that. So I think it's just a useful way of thinking around some of the different aspects that a pandemic impacts on. So this triangle I've used for a number of different things in the past as a way to just think about the different elements that might contribute to risk and vulnerability for health inequalities. So if we look at the who I am, it's really important to understand that none of us are one-dimensional. We are all made up of a number of different factors that make us who we are and that make us unique. So the who I am kind of creates that intersectionality between age and gender, ethnicity, if we have a disability, what our faith may be, our sexual orientation. And some of those factors don't remain static, they change through the life course. So, you know, we don't stay the same age. Our health and long-term conditions may change. And when you think about COVID and BAME communities, as Mindy's pointed out, our BAME communities are not a homogenous group. But when you think about risk and vulnerability in relation to COVID, some of our BAME communities have a higher incidence or prevalence of some long-term conditions. So there are a higher rate or new cases more likely to happen in some of around things like hypertension and diabetes. And these are seen as a risk factor in your outcome relating to COVID. So it's important to consider that. When we think about where I live and where I work, we've highlighted that for some of those reasons that Mindy's talked about, our BAME communities are disproportionately represented in our communities that are ranked as the most deprived, and that creates some specific challenges. In relation to COVID, we know, as we've mentioned, that means that people are more likely to live in inner city, densely populated areas where social distancing may be more difficult, both in the home environment and in the community, and where self-isolating might be more difficult. Similarly, we know that long-term exposure to adverse living and environmental conditions have an impact on community and resilience, and that will have an impact on COVID. Similarly, we've talked a little bit about how, again, our BAME communities are have been disproportionately represented in some of the occupations that are having greater exposure, some more public-facing roles like health and care, or in security guards, or some of those other occupations, which again increases that risk. And then the how I'm treated is also really important. So Mindy talked a little bit about that kind of direct, the impact of direct discrimination or stereotyping. So if your past experience of using health and care services has been negative due to stereotyping and assumptions around what people have attached to you, then your likelihood of using future services is impacted. So we've had anecdotal insight from our sort of voluntary sector third partners that for some of our BAME communities, there were real anxieties around going into hospital because there were concerns that you wouldn't come out alive. There were concerns around accessing testing in that that information may be used in different ways. People might get reported to immigration, or if your immigration status was a little bit insecure, that those services weren't for you. So again, that has an impact, a real impact on your access experience and outcomes. So the way those three things interact for an individual can significantly create variation in our vulnerability. So it's just to bring that to a bit more of an individual level. Can we just check, Mindy, if there are any questions in the Q&A before we move on to Shak?
There is one question. I can answer part of it. So somebody's asked, what was the rate of COVID on Leeds care homes? I unfortunately don't have the answer to that. Pierre, do you?
What I can say in terms of care homes is that we have, in this kind of second wave, as in many places, we have had a bit of a surge, and that now seems to be to level off and become a little bit more manageable again.
Yeah, it certainly wasn't double figures last month. So I'm hoping that's still the case now. But nationally, you've asked as well, how does it compare nationally? So nationally, I referred to a percentage. So it's 30% of all deaths attributed to COVID were people in care homes. Yeah. And you can get more information from the Office for National Statistics.
Yeah, and I think what Leeds does probably reflect the same as national is that the highest rate of deaths is still in hospital, followed by care homes, and then in the community, and then hospices. I think that's the trend for Leeds. Okay, I'm going to hand over to our colleague, NHS Leeds CCG, who I think is going to perhaps bring some of what we've talked about to life a little bit more. Is going to share his kind of story.
Thank you, Pia, and thanks for everyone for your time to listen to my sort of personal story. First and foremost, just to let you know that the images on there are not images from me or my family. They're taken from Google, and I don't own the copyright. And it's really important that I stress the copyright is not mine. I've taken them Google for the sole purpose of presented information for this session. And the second thing I do want to stress is that there might be some images that include language or iconography that might offend. The purpose isn't to offend, but it's to demonstrate what some people either within my family or within my wider network might have experienced through their life. And the other thing is, as anybody who will know me, is I can talk for a very long time if need be. So I've been told I've got 10 minutes. I'm going to try my hardest to stick to 10 minutes. But obviously, if there's any questions when I skip through certain elements, I'm happy to answer them. Obviously, I'm exposing my a little bit and my family's history, but I'm very happy to answer any questions you've got. So I'm going to start first by saying Assalamu alaikum. Hello, my name is Shakil. And the reason why I've started with that introduction is, first and foremost, my identity. There's lots of things that are important to me. Being British is important to me. Being Asian is important to me. And I know some people might challenge me in terms of I'm not practicing Muslim, but I'm still a Muslim, and the values that my religion gives to me is important. So I've opened with a greeting of Assalamu alaikum, which means peace be unto you. And my religion is all about peace. And this month, if you're not aware, is Islamophobia Awareness Month. So I wanted to open with that because I think it's really important that before I go into the main slide set, one, you understand where my value base comes from, and why it's important, as Pia and Mindy have mentioned, the importance of intersectionality. So I'm not just British, I'm not just Asian, I'm not Muslim in isolation, I'm all three, and I'm very proud of all three parts of that identity. And Shakil's the name I was given at birth, and I'll come back to why. I'm called, I refer to myself as Shak, and I'm perfectly happy for colleagues who are listening who will know me as Shak, I'm very happy for you to call me Shak, but it's important to know how I got to that stage. So I'm going to talk from my personal experience and my family's experience from the post-war period until present day. So in 1945, the Second World War came to an end, and it goes without saying there was obviously a significant human toll in terms of lives lost, and I certainly wouldn't want to gloss over the fact that this was a particularly distressing time for people across the world. But in terms of what it meant for me and my family, the country itself not only suffered significant human losses, but suffered significant financial losses, and there was a need for a rebuilding exercise. So at the time, the British Empire maybe was coming towards the end, but it still had colonies or former colonies, and a call for support from people in those countries to help support the rebuilding effort. So I think it's important, whenever I reflect on that, whenever people challenge myself, even to this day, about this notion that it's our country, we were invited here, and we contributed and continue to contribute to the economic success of the country. But I'm really passionate about the NHS. I love working for the NHS, and I'm really happy to contribute to the NHS. And only 3 years after the war, the NHS was formed, and you know, I'm going to use the term BAME, and we've had a discussion around that. BAME communities have made a significant contribution to the success of the NHS. But going back to my family, we spoke about the Windrush generation, but at the same time, there was a significant number of people who arrived from the Indian subcontinent, and I don't want to make my session political by its nature, but also the other thing that might get overlooked over this period is in 1947, India and Pakistan gained independence from the partition, and the way it was done was very controversial, and 1 million lives were lost at that time. So I think it's really important that people are aware of that, and actually I would, if nothing else, I would really encourage you to read some of the historical texts written by people who experienced the impacts of partition, because it's an often overlooked part of our country, as in Britain's role in that. But anyway, in the 1950s, my paternal grandfather came to England, so that's my family's sort of first immediate relative that arrived on these shores. And shortly after, my maternal grandfather arrived, and you'll notice for this period of my sort of family history, I'm talking about male members of my family. That's because they had one sole aim, and that was to come here, support the rebuilding efforts. But they felt their lives were still going to be in Pakistan. They were going to make money and support families back in Pakistan. So the female members of my family didn't arrive till much later. Anyway, my granddad, my paternal grandfather, he worked in the foundries, and my maternal grandfather worked in the cotton mills, and these images just depict people coming here in search of a better life, but also answering this call to rebuild the nation. And it goes without saying, they were seen as aliens by some people. They experienced very much direct racism, and that manifested itself in physical as well as verbal abuse. You know, continues to shape me and my family and the way we still interact with wider society, and why at times we still are nervous to present ourselves in a certain way, and in certain situations we still struggle. So sometimes I go to meetings, and I feel still to this day, even though everybody who knows me will assume I'm confident, but I still have that psyche that I'm always not good enough, and it goes back to those days. So I'm just going to move on to the next slide, which is the next sort of important milestone for me in my life. And the picture in the middle, I'm going to come back to at the end as well, but because I want people to remember two things. So from the first slide of partition, and I'll want people to remember this gentleman's name who's in the middle. So my dad arrived in this country in 1971, and that the image on the top left, he tells me that, I'm not sure about how much of an exaggeration it was, but apparently there was 6 foot of snow when he arrived in England. So he's come from 30+ degrees temperatures to a really cold nation. He went to college for a while to learn English, improve himself. But ultimately, he started working in a number of textile mills to begin with. So you'll see on the bottom left an image that's a National Front march. So that's the kind of welcome he received. And his sort of friends and family and our sort of wider family we received on a regular basis. And then there's two sort of key things that happened towards the end of this decade, which are symbolised by two images there. The one on the top right is copper fittings, which might look a bit odd, but my dad started work in 1979 at IMI Yorkshire Fittings, and he worked there for 24 years. And the reason that's important to me is it's the year I was born as well. So all I knew was my dad working in this factory for 24 years, so all through my formative years and after I graduated. And also in the same year, Margaret Thatcher came into power. So a seminal political moment for the city, for the country. So anyway, the chap in the middle is somebody called Altab Ali, and in 1978 Altab was murdered by racists in London, and I wanted to highlight his story, and I'm going to come back to it as well because he would have been roughly the same age as my dad, so my dad's been experiencing racism, but luckily he's not experienced it to that extent where he's had to lose his life. So for me, it was important that I reflect the loss of a human life through racism and racist attitudes that prevailed, and it's the overt racism again during this period. So 1979 I was born, 1980s is my sort of decade, my early year decade, and by the way, I know I don't look that old. So I became a fan of Liverpool, and I will always drop a Liverpool references whenever I get a chance. But that image there, I know it's really small, but it's of John Barnes, and it's a banana being thrown at John Barnes's feet. So again, 80s overt racism was still happening. We had hooliganism, which is the black and white image, and apologies, but the other image is of racist graffiti, which again throughout the 80s this was almost acceptable. My parents, for example, expected it, and I have to admit, we never experienced it to that extreme, but we were always prepared for it. When we were going to school, we were all prepared that be ready, not everyone will like you, and it's not a great start to life when you're given that sort of when that's drilled into you. But I want to move into the 1990s, mainly because I promised 10 minutes. I'm already nowhere near that. So in the early 90s, 1992, Stephen Lawrence was murdered. I don't really need to talk too much about the murder. Everyone will be aware of it. And I had just started high school, so Stephen would have been a few years older than me, still in high school. So it had an impact on me. And we've heard about the inquiry that happened afterwards. And as the decade progressed, on the previous couple of slides back, I talked about Margaret Thatcher coming to power. So there's two things in that early years that all I ever knew in one sense was my dad works in a copper works, and Maggie Thatcher's our Prime Minister, and then that became John Major, but it was always a Tory government. Come 1997, Labour came into power, and the song they played at the time was "Things Can Only Get Better," and I honestly thought we as a nation were moving on. I didn't really, when my parents talked about racism, half the time I used to think, what are they on about? If I'm honest, I didn't think such a thing really existed. I thought you lived through it, but I don't really experience it anymore. My friends come from different communities. My school's really mixed. I've never in recent times experienced anything. But at the back of my mind was this report, because this report into Stephen's murder I thought would make a huge difference. But as the decade came towards an end, I started understanding, becoming more politically and socially aware, and I thought things aren't changing. So whilst I can walk down the street and I won't be called X, Y, and Z, I'm not getting the same opportunities afforded in my life. And it's at this stage in my life that actually I wanted to change some of my identity just to fit in. So I was happy to be called Shak at school because it was quite cool. A ball player called Shaquille O'Neal, everybody called him Shak, and I thought brilliant. So I graduated in the year 2000 and started hearing reports about if you apply for a job and you put a certain name on, you're not going to get anywhere. So I decided Shak was what would be easier in that environment as well, because I also got sick of having to ring people up and they would ask your name and then ask you to spell it out. And I thought, well, it seems quite simple, but it clearly isn't. So people have called me Shak, I might as well use that as. But also at this time, what probably rocked me a little bit was the riots in Bradford. So there was some in the mid-90s, but the ones that happened in 2001 were huge. I'd never seen this sort of outpouring of emotion from the Asian community, and this is why it's important, why sometimes the BAME acronym has a place, but sometimes it's about understanding communities directly, because the Asian community generally didn't behave like this, so it shocked me to the core. And then obviously we go through this cycle, and I'm going to really quickly go through this slide because I know I'm massively running over, but we go through this cycle of constant unrest and upheaval, and then regular reviews. And what I've come from is this position where overt racism doesn't happen. This period where I thought, well, I'll change my name, but other than that, actually, society is very accepting of me. And then you start reading the reviews, and then you start reading another review, and then you need another review a few years later, and thinking, actually, very little has actually changed in that time, and actually very little, in some respects, has changed since when my granddad came to this country in terms of opportunities for career progression in certain industries, the fact that sometimes funding decisions are made in a way that are designed to fit the needs of other sort of political powers. So I don't want to dwell on this because I know I'm running out of time. So it's really important that I move on to the next slide. And obviously I've got the George Floyd graphic on there, and I don't need to dwell on that. We all know what happened there. So then we talk about the things that I never used to really reflect on, but microaggressions, and I've got a couple of examples there. So there's the book Why I'm No Longer Talking about race, to white people about race, but also this thing about where are you really from. And then sometimes I think you're asking me because you want to know me as a person. That's great, but actually sometimes I feel like you're asking me because I don't belong in this country. But I've just now demonstrated how my family directly has contributed to society and to this nation's prosperity. So I won't answer that question unless I really need to, unless I know somebody genuine wants to know who I am, where I'm from, for the right reasons. And if you get a chance, the third thing I would ask you to look for is it's a music track by Riz Ahmed, and it's actually called Where Are You From? I think he breaks it down brilliantly. I just want to end on two things. One is I started by talking about Islamophobia, and it's Islamophobia Awareness Month. There's a quote there which basically, in essence, sums up what it feels like for a Muslim in both society, but also in a work environment, that we have to always be within the accepted, legitimate vocabulary, and we have to monitor our own interactions because we're always fearing that we're going to be misconstrued or misunderstood. And I think that is, if anything else, I would really want people to think about how that impacts on a person's life. But I want to end on a positive, because we have in common that divides us. So despite all this, I'm still really positive that we're making progress, and COVID has shone a light on the impacts of race and racism on health inequalities. But maybe this is that seminal moment. Thank you.
Thank you, Shak. I think that's a really powerful story, and thank you for sharing that with us. There aren't any questions as such for us to pick up, although there was an acknowledgement that the snow was right. I'm conscious of time, so I'm not going to spend very long going through this slide, but just to sort of say that in Leeds, Shak, Mindy, Andy and myself and a number of other colleagues in the council and our partners have tried to address some of the elements that relate to COVID at a local level. So there's been quite a lot of work to try and address some of the health inequalities. And there are a few sort of examples here. We've done quite a lot of work around translating messages into community languages, including videos. We've had local pop-up testing centres that have been supported by door knocking in areas where we've had higher transmission rates. We've worked with the local radio stations to try and get campaigns out. So I won't go into that in too much detail, but I think it's to say that we have tried to use some of the information that we have to translate into action that is perhaps a bit more targeted. So we've mentioned Black Lives Matter, and I'm not going to dwell on that, as I think Shak said, everyone will be aware of that. And what I took away from it really was that opportunity for it to be a catalyst for change. And I really took away that if we really want to make a change, if we really agree that the injustices that still persist and that inequality is no longer acceptable, then we all have a role to play. And what we want you to think about a little bit about what you might do. So for me, in reflecting on that was one of the motivations for wanting to do this webinar, to kind of create that dialogue and discussion around what's going on. But so what we'd like you to do, to take away, I suppose, from today is a little bit to think about what action can you take, both in your place of work, if you are working, and perhaps what you can also do on an individual level. But we would like you to take that away from today. And then moving on really quickly. Again, I'm not going to go through this, but I think there is in a global world with relentless information and social media, there is a lot of misinformation out there. So this is just a little bit of a link to trusted sources of information, reliable sources of information. Again, I'm not going to run through it because of time. Similarly, in Leeds, we are really fortunate in that we are one of the few public health departments that still have a physical public health resource centre. And it's just to say that, again, the resource centre is there to support our local workforce around health and wellbeing. We're now semi-open on an appointment basis for resources and posters and leaflets. You can access previous Want to Know More sessions that have been recorded through the on here. We have a dedicated COVID page with up-to-date information and guidance. So again, I won't run through all of that. And then just if you have time for the last minute, if we can put that plain whiteboard up, just to say that we hope you found the session of interest and useful. We're really keen to retain a commitment around health inequalities in our Want to Know More About sessions. So we'd really like any suggestions for what people may have, for future suggestions that we could do that are either related to COVID or that are more general around important issues to do with health and wellbeing in Leeds. So if people have just a little bit of an opportunity before you go, if you could write anything there. And whilst you're doing that, I'd just like to thank everyone for taking the time to join our webinar. I'm just going to have a final check on the questions. There's a thank you to you, Shak, for sharing your story. There isn't a document as such around the sharing of the good practice, but as I said, the presentation will be up on our YouTube playlist. People will be able to go back to it, and if people have any examples of good practice that they'd like to share, we'd be really interested to hear that, even if it's outside of the presentation. And again, there's been a question around the trusted sources of information on the website. We can also, I think, if people would like, share the presentation so that they don't have to wait until the recorded version is up on the website. So again, if people would like that to happen, if you can just maybe say a yes on the Q&A, that would be really helpful. I'd just like to I'd just like to thank my co-presenters as well. There's a real thank you there to you, Shak, for sharing your story. I'd like to echo that, and we'll get the slides sent out to people.
Yeah, I'm really happy to support. I'm gonna have to shoot off soon, but I'm really sorry I couldn't keep the time. I mean, I don't even know why I promised that.
That was great.
It was such a powerful story, though. I think it needed to have the time to be told.
Yeah, thank you. So yeah, thanks for everyone for listening, and I'm sorry I've made you late for any other commitments, but I have to go as well. I've got another commitment, but thank you.
Thank you, Shak.
I really enjoyed listening to the evidence and insight, because that's my other side of my work. So yeah, thank you. I've learnt loads as well.
Thanks, Shak, mate.
Thanks.
Oh, okay. More statistics on people from BAME communities rehoused during the pandemic. Okay. All right, we're nearly 5 minutes over, so I think I'm going to say thank you very much, everyone. I don't know, Mindy, Andy, if you've got anything you'd like to add.
Thank you, everybody, for taking the time to dial in, and we'll make sure that we get kind of things sent out, the slides, if people want to follow up on anything.
Great. Thank you, everyone.